Hello, my name is Judy Machira. I'm going to be doing a presentation, and the title of my presentation is Primary Care, Why Preventive Care is a Priority in Modern Healthcare Delivery. So what is the problem? Chronic diseases are preventable. However, there are many patients who continue to suffer from exacerbations, poor quality of life, and eventually death. Prevention involves early detection of symptoms as well as proper management of existing conditions. The problem here is a complacency of how preventive care is being delivered today. There is poor standard of care in the cause, and this is the cause of the problem. Despite pharmaceutical advancement, this problem has not been solved. Preventive care therefore needs to be prioritized to deliver effective healthcare to the community. The background of the problem. So currently, the most common model of preventive care is where one is mandated to have a primary care. Some people don't, some people do. So this is where the patient has one doctor who they call upon when they are ill or wait for their annual checkup. The doctor does not follow up or call upon the patient to see how they're doing. This model does not address chronic diseases effectively. It leaves a lot of eligible patients out of the system and without proper management of the chronic disease. We know that chronic diseases need to be monitored. There's blood work to be done. There's frequent checkups and medicine reconciliation and adjustments here and there. The current delivery of preventive care does not seem to address these needs effectively. A list of common chronic problems include cardiac diseases, endocrine diseases like diabetes, hypothyroidism, and so forth, mental diseases, and a myriad of undiagnosed cancers such as colon cancer, breast cancer, and so on and so forth. Many patients with chronic diseases end up using the emergency room to seek care when they have these disease exacerbations. So they run there when they are emergent. Nurses are very familiar with this class of patients who have developed, and the nurses have developed a colloquial terminologies to refer to them, such as our friend, the frequent flyer, the train wreck, familiar to us. Many people know of a friend, of a family member battling a chronic condition. There are many people suffering from these diseases, and in this era than before, which has seen a lot of advancement in medical knowledge, and this picture does not sit right. So we go to prevention. Looking at the annual physical checkups by primary care, we can tell that they do not effectively address the problem in question. Another thing is that prevention includes early detection actions such as screening the at-risk people, as well as proper management of any existing diseases and consequent complications. For instance, people who are at risk are those that have not developed the disease, but they show signs of going towards that direction. For instance, people who have high A1Cs are likely to trend to diabetes if they are not prevented. People who have hypertension, they will end up with kidney problems and a lot of bodily function that are not at their optimum level. A better model needs to be adapted to ensure that no one falls through the cracks and that an effective model has been implemented in its place. Through reviewing a lot of evidence, patient-centered medical home is a model that came up, and showed promise that it can be easily adapted to help in the prevention of chronic diseases. So the prevention of the exacerbation of chronic diseases, and the answer to that is a patient-centered medical home. What is a patient-centered medical home? It comprises of all the tenements of good healthcare delivery. This model addresses accessibility, continuity, patient-oriented, it's team-oriented, and it's comprehensive. When we say it is team-oriented, it is a setting whereby several doctors work together to treat the whole person instead of different systems of the body. For instance, a practice that has a primary care doctor, it has an optician, it has a psychiatrist, it has a dentist in the same house, it has case management, of course nursing, it has nutritionists, interpreters, who are all able to address each and every patient's needs at any given time. This model of care is designed with the patient's family and community in mind. Studies done prove that the patient-centered medical home will lower cost, decrease emergency department visits, hospitalization, and improve overall quality of all the aspects of a patient's well-being. The patient-centered medical home also reassigns the roles played by the teams. For instance, the registered nurse reviewed role includes providing precise care and coordination for patients, making appointments and follow-ups to manage their chronic diseases. This also enhances the chances of reducing progression of the diseases. It gives consistent care while cutting costs by using evidence-based models to decrease or eliminate the frequent emergency room visits and hospital admissions. How is it significant to nurses? This evidence-based model is significant to nurses because, first of all, in researching, nurses are solely capable of solving this problem by strategizing methods of caring for this at-risk population and for patients already suffering from the diseases. For instance, for the nurses who work in the emergency room, what if they took a chance to categorize all these frequent flyers in quotes and find out, go a mile ahead or a step ahead and find out what is missing in their care and what is causing them to seek help at the department of the emergency department instead of other places of care where there's preventive care. So nurses have a good and a big chance to address this issue squarely. Nurses are continually educating their patients every day. They have access to the patient suffering from chronic diseases in the emergency room. And if the administration can find ways to implement programs where nurses are equipped with knowledge so that they can address the problems with chronic diseases spread. And more patient-centered medical health home, nurses can readily adapt it in the emergency room because they already know how to work with teams that resemble the medical home teams, and they're capable of serving diverse patients. So the purpose of doing this study was to find ways to stop the progression of chronic diseases, and especially for patients at risk. This is in an effort to keep them disease-free and to also help them with the progressing to full-blown diseases, at the same time helping them live better quality of lives by aligning them with the proven model of patient-centered medical home. So there was a lot of literature that proved that patient-centered medical home works. We know that primary care has been promoting the health of the society more than any other aspects of healthcare delivery, and research has proved this fact. The only shortcoming was that the method it was delivered, the way it was delivered, was found lacking. Therefore, there should be a joint effort by all stakeholders, by them pushing towards having more local primary care providers so that they can improve the health of the community from down the grassroots level. Registered nurses, their roles can be reviewed by providing precise care and coordination for patients, such as appointments and follow-ups to manage their condition. This will help in stopping the spread of or the progress of the chronic diseases, minimize emergency room visits and eventual hospital admissions and readmissions. So the research question that we're trying to answer here is, why should chronic diseases continue to rise in this era of advanced medical knowledge and technology? Why can't we stop that? Why doesn't the current primary care model work? And what can nurses do to help the at-risk patient from suffering from, to be specific, amputations, poor quality of life, needing oxygen unnecessarily, going blind, having to go through chemos while the cancers would have been, caught early and eliminated. So the conclusion of this studies has come up to say or to show that primary care has been pushed at the back of the seat in the healthcare delivery. Other specialties have been given more attention, and this has been proven that most primary care doctors leave the primary care to go and specialize because there is more remuneration. Therefore, there have been a shortage of primary care doctors, and eventually the delivery of primary care has taken lesser and lesser priority in the society across the globe. Meanwhile, while this is happening, patients continue to decline, and these are the patients that we see in our daily jobs as nurses, coming to the hospital frequently and dying with diabetes or things that can be prevented, kidney problems, hypertension. The other thing that nurses are able to do is to make sure, or the whole team, is to make sure pharmaceutical reconciliation is constantly done. This has caused so many problems that we are dealing with, like the opioid epidemic. Further than that is going back to the chronic diseases. Most people who end up sick have been found not to follow their medication properly, or it has not been adjusted in time. And there has been polypharmacy, where a lot of medical reactions happen and patients suffer more. So back to the conclusion, patient-centered medical home, if adapted across the board in the healthcare system, chronic diseases can be easily curbed and prevented. Nurses can play a major role in the patient-centered medical home. Their role in care and coordination of patients, appointments, follow-up, education have proven that they can reduce the epidemic of chronic diseases. And those are references. Thank you very much. I hope you and I can look at this problem and find ways to contribute in coming up with a solution. Thank you for listening.